Welcome to the Male Fertility Podcast. This is the post-bag episode, the very first one. And today you have me, Ciaran. The idea of the post-bag episodes are for you to send in messages and questions that we can answer. And we really love to hear from our listeners. We've got some great questions today that I will go through shortly. And if you'd like to send in a message or a question, please, all you need to do is email the Male Fertility Podcast at gmail.com. Now, for the first question from David, and it reads, my partner and I have been trying to conceive for a while without much luck, and it's starting to worry me a bit. And I'm starting to wonder if there's an issue my side. I keep hearing that male infertility is more common than people think, but I have no idea how I'd even go about seeing if there's a problem. How can a man tell if he's infertile? And are there any signs which I can look out for? Yeah, this is a really valid question. And I think a lot of men don't really think about their fertility until it's an issue, until they're told. David, this is amazing that you've reached out and put the question forward. How can you tell? Now, there are a few telltale signs, but ultimately you need to go to your GP and have a semen analysis. And there they will look at your sperm count, your morphology, and your motility. So for morphology is the shape of your sperm, and the motility is how it moves. All really key and vital in terms of healthy sperm. Before you get to your doctor, before you go to your GP, other things that you may have symptoms on or signs of are like sexual function issues. So you might have erectile dysfunction, reduced sex drive, or issues ejaculating. These are common, but they're common with fertility, but they're also common in terms of a perfectly fertile and healthy man. So it can be a sign, but it's not always. Additionally, there can be pain or swelling in the testicles, lumps. These can be signs that there's an issue, obviously, with the testicles. As we said in our quite recent episode with Henry and Alan Pacey, if you've got any concerns about lumps in your testicles, get straight down to the doctors, contact your GPs, let them know your concerns, and they would do you a physical examination and take you from there. But it can be a sign that there's an issue with fertility or in the testicle area. Additionally, there can be changes or slightly small testicles. This can be a sign that there's an issue maybe with hormones. But once again, you have to consult your GP to get a real accurate diagnosis of that and the reason why your testicles are small. They'd send you for additional testing and some blood work, and it would highlight if it's a hormone issue. And additionally, hormone changes. Things like going bald quite young, or like I did, or going bald in general. I went bald at 25 and I didn't know at the time, but I now know that might have been like a symptom of my fertility issues. It's not necessarily 100% guaranteed. People do just go bald, but for me, I think it was a telltale sign. And additionally, you can have reduced muscle mass, increased breast size tissue. These things can all be linked to reduction in hormones, which can be a sign of fertility issues. As I said at the beginning, it's really important to consult your GP about this. This is what I've learned along the way, but getting real medical advice is highly recommended. And it will also get you on the right track to be properly tested and receive a semen analysis if you need one. But your GP will help you with that. So great question, David. I wish you all the luck and let us know how you get on. Question 2 comes from James, and it reads, I've been thinking a lot about my health lately, especially when it comes to starting a family. Me and my wife are thinking of starting a family soon. Are there any specific things I can do to aid my fertility? For example, lifestyle changes or habits I could embed into my life to help me be more fertile? Great question, James. First of all, well done for being proactive about it. And quite often us guys, like I said previously, we don't think about our fertility until we need to. So it's really good to hear that you've been proactive and that you found the podcast and I found it useful, even if it's just sending this question and engaging with us for this reason. So thank you so much. There are things you can do. One of the biggest things I would suggest is looking at your diet. Try to optimize your diet and make it as balanced as possible. Get heavily processed food out of your diet, takeaways and high processed meals and pizzas, everything like that. And focus on high nutrient rich foods, organic if possible, whole foods as well. So fruits, vegetables, lean meats, whole grains, things like that. It sounds like common sense because we're told it all the time, but life is busy and I completely understand that many of us eat what's available to us at the time and what's quick and what's easy. But yeah, think about what you're eating. Also, foods high in antioxidants, so things like berries, nuts, leafy greens, can all really benefit your fertility. It is cheesy, but literally you are what you eat. So if you put good food into your body, it rewards you. And also make sure you're trying to get those key vitamins and nutrients into you. Management of weight is also something you can do. If you believe you've got a slightly high BMI or that you're slightly overweight, changing your diet will help, but also bringing in a healthy amount of exercise into your life, if you don't exercise already, would be a good step forward. It will help you manage that weight, but also keep you active and help you de-stress. Trying to de-stress as much as possible is really important, even though it's incredibly difficult. We live in such a busy and sometimes engaging world. I'm going to use the word engaging in terms it's relentless, isn't it? So trying to de-stress in any way you can, even if it's a few days a week, you make time for yourself, time for you, time for your partner, make time for yourselves. That will help you de-stress. And if you're in the place, talk to work. If you really got a lot of stress going on at work, talk to them, explain that you're trying to start a family and you're feeling rather stressed and you're aware that stress can impact fertility. Yeah, be open and honest, even though that's tricky sometimes. The last three things I'm going to say is if you smoke or drink, cut the smoking out. Smoking is one of the worst things you can do for your health holistically, like completely. Like it's incredibly bad for you. So just get rid of it. If you need help with that, go to your GP, ask for it. There are support structures out there. There are schemes in place to help people stop smoking and give them the strategies they need. Reach out for help. In terms of alcohol, limit it as much as possible. For me, I took the approach that I stopped drinking completely just to eradicate it. I also found it helped my mental health, reduce my stress a bit. And it also helped me have better sleep, which is the next bit of advice I'd give you. You want to be sleeping around 7-8 hours a night because poor sleep can really disrupt hormone levels. So yeah, making sure you get a good amount of sleep will help hormone levels, but also help your body recover if you're training and things like that. So sleep is a powerhouse when it comes to health, and that includes fertility. Lastly, I'd say is stay hydrated. It's a small tip, but hydration is important for all over health. Yeah, make sure you're drinking the recommended amount a day, which is at least 2 litres. Everyone's slightly different. There are websites which will tell you exactly how much you should be drinking for your size and body weight, but roughly around 2 litres would do the trick. I drink about 3. Some people drink a bit more, some people drink a bit less. But yeah, stay hydrated. I hope that helps. Let me know how you get on. We'd like to hear from you again. James, it would be really good. And if you need any additional help, feel free to ping me a personal message. I'd have that conversation with you. So next question is from Alex, and it reads, I've been feeling pretty anxious lately. I recently found out that I have a low sperm count and I can't stop worrying about what this means for my chances of becoming a dad. Is it still possible for a man with a low sperm count to have children? Alex, I can tell you that 100% it is. And the reason I say that is because I am a man with a low sperm count. If you haven't listened to it already, the second episode of the Male Fertility Podcast, I go into quite a lot of depth about my story. And I was basically told after my second semen analysis that I was producing around about 1,500 sperm per milliliter. and less than 1% of it was viable. 15. It's pretty low. Through things like lifestyle changes that I spoke about for James's question previously, in implementing them and having a varicocele addressed, did rise things slightly, but I was still deemed as having, or I am still deemed as having, a low sperm count. But you can 100% still have children with a low sperm count. It doesn't always work out. Things do happen, and it can be a very challenging journey. It'd be interesting to know how you've come to know that you've got a low sperm count, and if it's through a clinic or some kind of test that you've had at the GPs. Speak to the source of the information. So if it's from your GP, speak to your GP. If it's through a clinic that you've done privately, speak to them. They'll be able to help you. But yes, it is, my friend. It is possible to have children with a low sperm count. Next question is from Anonymous. So this is quite a good time to highlight that if you do send in a question and you don't want us to say your name, please just let us know. There's no need for everyone to know who you are. So just let us know and we'll just put it in as anonymous. But this question is a good question, and it leads on to something going on in the NeXYs community very soon. I've been feeling a bit worried lately because I've noticed some discomfort around one of my testicles, and I've started to wonder if there's something wrong. A friend mentioned something called a varicocele, but I don't really know what that is. What are the main signs of varicoceles, and how would I know if I had one? Well, this is a good question. I myself have had a varicocele, so know how they feel. And I completely understand feeling worried, because I remember that kind of sinking feeling when I first felt mine. So a varicocele is basically an inflamed or clustered tubes on your testicles. They're inflamed, they're larger than they should be, and they feel like those little worms or like tubes, can feel a bit lumpy. So it's worrying when you find them. They are very common. A high percentage of men actually do have them. It's not uncommon for a guy to find them, but they do and have been proven to impact fertility, basically because they heat the testicles up. So what are the signs of it? Like I said, there's that uncomfortableness, a lump in the tubes in the testicles, and that feeling of like little tubes or little worms in the testicles. It's not worms, it is your veins, but that's how you can describe it. A dull ache, like I've just said, is that pain, the dull ache, like continuously there. It doesn't go away. It's something that some people I've spoken to just thought that everyone's balls felt like that. I mean, it's not the truth, is it? Like, they shouldn't hurt. So if they are a bit painful and you've got a cluster of tubes or what it feels like in your testicles, it could be varicoceles. These veins could be visible as well, like in terms of feeling them. Some varicoceles you can't feel, some you can. The testicle size could be different sizes because of the swelling, once again. And all of these things are typical signs of varicoceles. I will highlight they are signs of other issues as well with your testicles. So it's vitally important that you go and get checked if you have any concerns. If you have any concerns about your testicles, changes in them, lumps, clusters of tubes that you're not sure what they are, go and see a doctor. They will physically examine you, and then they will, hopefully, direct you down the appropriate treatment route, even if that is just to see a urologist and further testing. But talking about varicoceles, on the 19th of May, we are hosting a webinar with Dr. Stephen Moser, and he's going to take us through basically varicoceles and male fertility. It should be a really interesting conversation, something that I'm definitely looking forward to, and the community is looking forward to already. If you'd like to become a member of the community, all you need to do is go to NeXYsFertility.com and sign up to become a member. It's that easy. And NeXYs is spelled NeXYS, fertility.com. And you can join us on the 19th of May at 7:30 for a webinar with Dr. Stephen Moser and learn about all things varicoceles and male fertility. But in the meantime, as I said, If you've got any concerns that you might have varicoceles or have got lumps or soreness in your testicles, go and see a doctor. Okay, final question for today's episode. This is another anonymous question, and it reads, I'm feeling pretty confused and worried right now. My partner and I have a child together already, but we've been trying for another without much luck. I always thought that after we'd had one child, we'd have no problem having another. Can infertility happen even if you've already had a child? If so, what could have caused it? I didn't expect this to be an issue for us. So your questions are really important because it's quite often something that people don't think about when they've had a child naturally, that they may become infertile and not be able to have a second child. And it's called secondary infertility, and it's a lot more common than you probably think it is. It's just as challenging as primary fertility issues. My advice would be contact your GP and starting those investigations. I really hope it works out well for you. But as I said, secondary infertility is not uncommon, and it's a topic that needs to be talked more about. The emotions linked to it, the experience linked to it is a very valid conversation to have within the fertility world, and something that I'm sure that we will explore further in the future on the Male Fertility Podcast. So that is the end of the very first post-bag episode. If you'd like to reach out and send us a question, please email us at the Male Fertility Podcast at gmail.com. Also, follow us on Instagram at the Male Fertility Podcast, and also like our Facebook page, which is also the Male Fertility Podcast. Subscribe to us on YouTube. We're now on YouTube, and join us for the next episode where we will be talking about why fertility matters at work. Until then, take care. Thanks for listening. If you found the value in today's conversation, please follow the show and share with someone who might benefit. We'd love to hear from you. Share your questions and feedback on our social media channels or email us at themalefertilitypodcast@gmail.com. And follow the show on Instagram at the Male Fertility Podcast.
You can also find Ciaran on Instagram at the Male Fertility PT and me, Sean, at knackered_knackers.
Remember, you're not alone. See you next time.